Welcome to the 2023 NNLM Virtual Symposium on Health Misinformation. We are glad you are here to join us today. I am Deborah Trogdon-Livingston, User Experience and Education Strategist for Region 2 of the Network of the National Library of Medicine and the Medical University of South Carolina. We have just a few technical items to cover before we get started. All attendees have been muted, but we do welcome your questions and comments in the Zoom chat at any time. VFairs is providing technical assistance today. NNLM staff will be keeping an eye on the chat with me. Please be sure to select everyone from the drop-down menu when posting your questions and comments in chat to ensure everyone sees them. Submit questions for speakers using the Q&A function to ensure they do not get lost in chat. We have live closed captioners for this event. You can access the closed captions by clicking on the icons with the three dots and then selecting closed caption. If you would like to share on social media, we encourage you to use the hashtag for the event. You can see it on the screen. It's hashtag healthmisinfo, MISINFO, Before we get started, I'd like to share a little bit about who we are. The National Institutes of Health is the nation's leading medical research agency. Many of you might be more familiar with the National Center for Allergies and Infectious Diseases, which is one of the many institutes and centers at the National Institutes of Health. NLM, or the National Library of Medicine, is one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NLM, the Network of the National Library of Medicine, is an outreach program of NLM working to ensure health professionals and the public have equal access to health information. NLM, the Network of the National Library of Medicine, is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 NLM member organizations. It is my pleasure to introduce today's speakers, who are, the first set of speakers are all from the University of Alaska, Anchorage. We have Dr. Jennifer Meyer. Sorry, folks. All right, so I'm hoping that you can still hear me. I did have a little technical issue, but that's okay because we're almost to the point where our lovely speakers will be taking charge. I am excited to welcome our speakers. If you all, yes, I'm sorry, Dr. Jennifer Meyer, she, her pronouns. Dr. Joy Chavez Mapeye, she, her pronouns. Alexandra Edwards, she, her pronouns. Sean Butler, she, her pronouns, and Dr. Gabriel Garcia, he, him pronouns. Thank you for your patience, and I will turn it over to you.
And thank you so much for the opportunity to speak with all of you today. I'm going to go ahead and share my screen. And I'm going to go ahead and share the slideshow. And can everybody see that? Okay, wonderful. Hello, everyone. I'm Joy Chavez Mapeye, Professor of Journalism and Public Communications at the University of Alaska, Anchorage. I'm here with my colleagues, Dr. Jennifer Meyer, Dr. Sean Butler, Ms. Alexandra Edwards, and Dr. Gabriel Garcia. And we're here today to talk about the Alaska Health Misinformation Response Project. Our research team really came together early in the pandemic in March 2020, when the World Health Organization warned of fighting both an epidemic and an infodemic, where fake news spreads faster and more easily than the virus itself. Little did we know then that the infodemic would shape the course of the pandemic. From our research team, we developed the Alaska Public Health Information Response Team, where we began providing accurate health information on public-facing Alaska Facebook pages. Our goal wasn't to battle it with the trolls. It was basically to provide good information to counter the bad. And here's how we did that. Strategic communications students would monitor 30 public-facing pages. Once a comment was flagged as misinformation, the comment would be sent via Remind app to me, which I would then send to a team of volunteer responders with backgrounds in healthcare, public health, research, and so on. And here's an example of one of those, one of Dr. Meyer's responses. She often used GIFs and GIFs to get people's attention, and some even included Beyonce, as you can see here. In this response, she's pointing out that the research shows the effectiveness of the COVID-19 vaccine. Our best practices included something we developed called the Triple E. Let me see if I can get to that slide. And the Triple E is basically engagement with empathy and education. We wrote for those reading the thread and not the misinformation commenter. We included a lot of visuals, as you saw there earlier. And we also included something called the truth sandwich, where we'd start with the truth, indicate the lie, and then end back with the truth. So we officially launched Response Team in 2020 and began comprehensive misinformation response in fall 2021, where we brought in more research, community engagement, and worked with our computer science colleagues. Before we get to that, however, Alexander Edwards will discuss the initial evaluation of the team.
Sorry, this mute button is always hiding. Thanks, Dr. Mapaye. So the initial evaluation of this project was designed as a formative one. We were really just seeking to understand how we could even go about evaluating the team's efforts. Next slide. We were guided by 4 initial evaluation questions that we selected to help us understand how the team functioned, how comments were being monitored, how the team was responding to misinformation comments, and whether team responses resulted in any type of change in public engagement with misinformation comments. Next. Our challenges in operationalizing the evaluation were threefold. Firstly, we had no template or guidance for this. At the time, previous research appeared to have been done primarily in simulated environments and not the real-world fluid Facebook environment. Secondly, Facebook places strict limits on automated data collection, and the automated data collection tools available at the time did not apply to the small pages that we were monitoring. And thirdly, we weren't really sure how to actually measure or track change in public engagement. We settled on a definition of public engagement as Facebook users other than the initial misinformation commenter or response team member clicking on a reaction emoji or leaving a comment in the comment thread. Reaction emojis were classified as either positive, so for example, likes or hearts, or negative, angry. We also determined that at least initially, we would have to collect this data manually. We created a data collection form specifically for the project to track the date and time of each alert, whether there was a team response, by how many team members, and how soon after the alert went out. We also counted reaction emojis on misinformation comments in our team responses. I also want to reiterate that we only collected data from public-facing Facebook pages. Over the next few months, we counted more than 1,500 team responses and determined that a core group of the response team was responding to most of those alerts. About 80% of all alerts had at least one team member respond, and the positive public engagement exceeded negative engagement at a 5-to-1 ratio. That is, our team members' response comments overall generated more likes, more hearts, more positive comments and support than did the misinformation commenters. While not perfect, this initial evaluation laid the foundation for the work undertaken by Dr. Sean Butler and her computer science team in late 2021 that's continued through 2023. And I'll pass the baton to Dr. Butler.
So what we wanted to do with the computer science team is doing 2 things. One is to see how effective that the responses were that were coming after the team responded. And so what we did was we compared the responses, the replies, the comments that once the misinformation was posted, we actually looked at all the replies shortly after that alert was posted, and then we looked at all the replies after our response team replied. And what we were trying to do is capture the sentiment analysis prior to and after the response. Next slide, please. So in looking at this, we used sentiment analysis, which is used in machine learning quite frequently to determine basic sentiment of comments and reviews and things like that. And what we discovered was that it's a scale of -1 to 1, 1 being positive comments, -1 being negative comments, negative sentiment. And before the response was posted, before our responder actually posted their debunking information, there was approximately a neutral sentiment around that misinformation prior to our response. Once our responders responded, that sentiment changed very positive. So what was happening were people were getting very supportive of the actual information, correct information that the responder had posted. And so that's a really good sign. It doesn't last forever. Obviously, all the comments tail off. But basically, what we saw was about a 640% change in sentiment overall in the project. So that told us that I think that there was some effectiveness to the debunking for the misinformation. Next slide, please. The other thing we had trouble with, and I think everybody struggles with it, is to determine the difference between we collected all the data, but trying to determine which comments were misinformation and which comments were not misinformation. We collected a lot of data on Facebook, but it still wasn't enough. And all that data had to be labeled. Labeling is extremely important in machine learning, and because you need to know whether something is misinformation or is not misinformation. Since we didn't have a whole lot of data, what we wanted to do was we found a Twitter database that had already been labeled. And what we wanted to do is train our models to actually use that Twitter data to fine-tune the model. You evaluate it, then you fine-tune it, and with those hyperparameters, you actually end up selecting the best model possible. Next, please. And so what we did was it didn't turn out perfect. We didn't expect it to, but what we did find out that the model, the BERT classifier, which is a particular type of sentiment analysis classifier, was able to identify about 70% of the time misinformation. So you can see the upper right-hand bubble is filled with a lot of misinformation, the red dots, and the green dots are information. What that helps us with is we get to the misinformation much faster, and it takes less time to weed out the non-misinformation from the misinformation. It doesn't do well, this model, in identifying non-misinformation. It tends to still get some misinformation in that model. So we still have to go that, but it definitely reduces the amount of time it takes to label misinformation. Without labeled misinformation, it's very difficult to build models that will actually find misinformation in a more automated fashion. Next. With that, the next speaker.
So for our research, we conducted a survey among Alaskans, wanting to find out what the factors are associated with COVID-19 vaccination. Next slide, please. We use a cross-sectional study design using Qualtrics platform for our online survey. We collected the data from May 2022 to June 2022, and this was the time when children under 5 years of age and a COVID Omicron booster have not been available in the US as of that time. Next slide. We have several study variables that we looked at. We looked at COVID misinformation, COVID knowledge, perceived risk of harm if they did not get a COVID vaccine, motivation not to get infected by COVID, personal ability to get vaccinated. We asked questions whether their social network is vaccinated. All of those we looked at in our survey. Next slide, please. And so what we found was, in terms of the factors independently associated with ever been vaccinated, and ever been vaccinated is defined as those who have ever received an approved COVID-19 vaccine, whether or not they have completed the series or have been boosted. And what we found was perceived risk of harm, social network, being male, and being not married, being married are the factors that are independently associated with ever been vaccinated. So we asked the question, why is it that misinformation or political ideology not showing up to be significant factor. So we ran another multivariate analysis looking to see what the factors are associated with perceived risk of harm. Next slide, please. And what we found was a COVID misinformation, COVID knowledge, motivation not to get infected by COVID, and social network were all independently associated with perceived risk of harm. Given the results of this multivariate analysis, we then propose the following conceptual framework in understanding how decisions are made related to vaccination. Next slide, please. And as you can see here, attitudes and beliefs appear to be directly associated with the behavior, i.e. the vaccination, and that the social network, our social environment and misinformation affects both our attitudes and beliefs. And the type of media that we consume affects the types of social network that we belong to and the kind of misinformation that we get. And what we found was the type of media consumed is also related to political ideology.
Thank you, Dr. Garcia. So while our project started out primarily looking at debunking COVID mitigation misinformation and COVID vaccine misinformation, as the pandemic progressed, we found ourselves debunking a lot of just general vaccine misinformation. And you can see some of the recent news here portraying a lot of concern from pediatricians regarding the very low vaccination coverage rate for children. And this was highlighted in a recent MMWR report, which showed that Alaska, unfortunately, has the lowest vaccination rate for the pediatric required vaccines in kindergarten. And so we need to mobilize a response to how we're going to deal with that. Next slide, please. So our healthcare providers, health workers, public health workers, I think we all know misinformation is driving a lot of negative health behaviors. And this infographic is hot off the press from the De Beaumont Foundation. I think it came out just a few days ago. And so we know that misinformation can affect individuals as well as populations, and our provider groups are really struggling with how to respond to that. So our project pivoted to try to create resources and help clinicians figure out how they're going to identify, manage, and respond to misinformation in their clinical setting as well as out in the community. Next slide, please. And one of the things we learned that I think is so important, I'm a nurse by training, and when I was trained over 20 years ago, misinformation and anti-vaccine information, we were told to just ignore it. It's fringe. It's not. It's a small group of people. And while it is a small group of people, it is having a dramatic effect. And we need to think through how we're going to manage that. So in this example here, one of the things I learned as being a responder on the project is that you're often addressing misinformation in a media setting or community setting, not just to try to convince the poster of that information to change their mind, but you want to be present in the social environment so that you can offer that science-based information, because you never know who's reading or listening to what you're saying. And so here's an example where the comment thread was filled with all kinds of false claims about vaccines. And so I tried to post some information about a recent survey that we did for the municipality. And I was reassured that time and time again in our surveys, we see about 70% of the population responding to the survey follows the recommended guidance by scientific consensus around vaccination. So I'm always reassured, but our media environments can really create that false equivalence that it is a controversial issue, while the majority of Americans accept vaccine and the science around vaccination. So when I posted this, again, this shows you never know who's reading your comments. So here's a person that read my comment and then said, thank you for this. It can feel as though the problems won't improve when I look at so many of the responses. And I replied to her, just remember, there's more of us, and tried to give her that encouragement, because it can feel really defeating. You can get really burned out. And one of the ways we tried to support providers going forward, healthcare workers, our students who are learning health science, is to create a series of resources that's posted on our website that clinicians could use to start the conversation with patients and raise awareness around misinformation and help clients, patients, community members become more resilient to that misinformation. And I'll post that link in the chat. And that's the end of our presentation. I would invite questions. We have, I think, about 4 minutes of our 20 minutes here, or we can wait till the end, whichever the host would prefer. Feel free to reach out to myself, Joy, or any of the panelists. We are really in uncharted territory, and this project was really innovative and cross-disciplinary. And I just am so grateful to be members of such a great team. So thanks, everyone.
Thank you all for that excellent presentation. I didn't see any questions in the chat or in the Q&A. If you all have any questions, I'll wait just a couple seconds since you guys left a few minutes. And if we don't see anything relatively quickly, then we'll move on and we'll take any questions, because sometimes you might need to think about it that you guys might process that you need to answer at the end. So I'm still peeping it out. I was really interested and excited about being able to utilize a specific plan to identify misinformation. So I really enjoyed the chart and the visuals that you all shared. Very nice. All right, so I'm thinking probably people are going to ask at the end. Let's just take a moment. Oh, as soon as I said that, somebody answered. That was totally perfect. Someone asked, were there any linkages between the project and the Alaska Division of Public Health? Great question.
Yeah, Alaska is a very small town. We have about 750,000 people in the entire state, and the public health community is very close-knit, and a lot of our colleagues and network is members of the Division of Public Health. And we worked with them very closely, hand in hand, collaborating with their public information officers. And in fact, as the pandemic progressed, Joy and I would regularly attend those public information calls where you had public information officers from throughout the state calling in, and we would provide an update on what we were seeing in the Facebook environment. Facebook is the site that most Alaskans check on a daily basis. And so we would provide an update about what we were seeing. And sometimes the public information officers throughout the state would clue us in to some issues on their personal website, not personal, their work website, like, for example, the city of Juneau. And they would say, you know, we really need some help. And so we would dedicate some responder resources to debunking some of the misinformation. Every time they put information out about the pandemic, you kind of invite misinformation in the comment threads. And so we were available to cover them, so to speak, so that we could debunk in real time. And that was really reassuring to the public information officers, and we were frequently thanked for being available.
That's a really important and beautiful collaboration for sure. I want to point out, thank you to Dr. Jennifer Meyer for posting a link to the additional resources, the description in the webinar chat. So if you guys want to make sure and note that, that can give you some follow-up. And the last one we'll answer right now, and we'll take more questions at the end, is Angela Lee would like to know, did you use your public health office name to counter misinformation so it legitimized your response? Great.
This was so interesting. We responded as volunteers, and these were colleagues in the scientific community, public health workers, physicians who volunteered. And I started out with my name, Dr. Jennifer Meyer, on my Facebook, and I experienced more attacks in that way, you know, pharma shill and things like that. And then when I changed my name to something that wasn't female and I didn't have my doctor in front of me, I got much less. And so so that was just an interesting experiment. Somebody should study that. But I think one of the things Joy taught me was how to protect yourself in the media environment, and her background in journalism and strategic communications was vital and part of our training. So we trained and vetted our volunteers kind of in the model of Shots Heard with Dr. Todd Wallin. And so we knew that we had this group of about 30 folks and we could rely on each other. I think that vetting of volunteers was really, really important. And then, of course, we trained them in the Triple E and the Truth Sandwich. So that also prevented a lot of trolling because we were providing empathy in the way we responded. It was not an attack. And if a commenter attacked us, it revealed a little bit more about them than it did about us. And often we were thanked for providing links to good information.
That sounds like a very intentional approach, and it sounds like it worked really well. Thank you all so much. I'm going to share my slide briefly before we start our next presentation. So we'll definitely take more questions. So keep adding them to the chat and to the Q&A, and we'll keep looking. There's one that'll be coming up toward the end. I just saw one pop up. So bear with me for one moment. All right. Okay. I'm having woes today. Thank you all for being very patient. I am excited to introduce our next speaker, Jared Irwin, he, him pronouns. He's the Behavioral and Health Sciences Librarian for East Michigan University. And I will stop sharing my screen now and pass the baton on to you.
All right, thank you so much. I will go ahead and share my slides now. Right, are people able to see that?
Absolutely.
Perfect. All right. So thank you again for that introduction, and thank you to you all for joining me. One piece of folk wisdom about social media is that you can prevent a lot of the problems that you might have by just not posting. Although this advice is usually given to overly active social media users, there are situations where it's true in deciding what to do about health misinformation that you might find. Thinking through those situations is our topic here. Just to give an overview of what we'll talk about, I'm going to give some context about why this is important. We'll look at 4 questions that you can ask as you decide whether a piece of misinformation that you see on social media should warrant a response. And finally, we'll use these questions to explore some real-life examples of health misinformation on social media. So let's get started. Now, why is this important? Since trust in established and reliable sources of health misinformation is declining, a reputation of being trustworthy about health topics is a valuable resource to manage. And although there has been research on effective ways to correct health misinformation, some of which you've heard about elsewhere at this symposium, less is known about the reputational risks to navigate when doing so. These reputational risks can be important if the correction is not done thoughtfully and deliberately. And as an example of what I mean, I want to talk about one case from last year. So in 2022, there were some posts on TikTok that depicted people cooking chicken breasts in liquid cold medicine. And this came to be known as NyQuil chicken. So the FDA released a warning about the very real dangers of misusing cold medicine in this way. Their warning described it as a social media challenge. And it got lots of media coverage and media attention, but there was also criticism about calling undue attention to this activity that seemed to be very rare. Or they were criticized for implying by making this press release that it was more common than it actually is. Now, there's no evidence that the FDA actually caused more people to make NyQuil chicken by putting out this statement. But the statement and the news coverage about it did at least cause a spike in searches for NyQuil chicken on TikTok and elsewhere. Even though the FDA was correct that this could be dangerous, they received high-profile criticism for this. These two headlines followed the FDA's announcement. The New York Times said, FDA warning on NyQuil chicken alerts many to existence of NyQuil chicken. There was even criticism from overseas. The Guardian in the UK said, interest in dangerous NyQuil chicken videos surged after US agency warning. You'll probably never have articles like this written about you or your institution. Nonetheless, the people in your community and your social networks likely see you as a resource for good and meaningful health information. That reputation is worth protecting. And the 4 questions that we're going to look at are intended to help prevent some of the missteps that might put that reputation at risk. So now we will move on to talking about those 4 questions. So first, what is the purpose for which a given piece of misinformation was posted? There are many possibilities. I've listed just a few here. Persuasion includes both intentional falsehoods and situations where the posters themselves may be misinformed or don't know better. By challenges or social media challenges, I mean posts that explicitly encourage imitation and participation. One well-known example was the Ice Bucket Challenge from 2014, where lots and lots of people posted videos dumping buckets of ice water on themselves to raise awareness about the disease ALS and to encourage donations to fund research. You probably saw a lot of those on social media at the time. That's often the kind of widespread imitation people think of when you say social media challenge. Trash posting is creating intentionally low quality posts that are meant mostly just to provoke a reaction. You might have heard a similar term for trash posting that I'm not going to use here to keep things family friendly, but if you've heard that other term, this is the same thing. In general, something that encourages people to change beliefs or behavior in some way and is posted for that purpose is more likely to warrant correction than something that doesn't, like a trash post or a joke. Now, it can be hard to judge the intent of a stranger on the internet, of course, but there are a few ways to at least look for clues as to the intent of a given misinformation post. First, assume that you're not the intended audience for the post, and that the way you read it might not be how the intended audience receives it. This is related to the idea of context collapse on social media, where you have lots of audiences in one place who are all hearing the same messages, even those that aren't really intended for them. So to help get a grip on that, try to skim through several replies to a post to get a sense of how most of the audience is receiving it. For example, if they're treating it like a joke, or if they're riffing on it and following up with more jokes, it may just be intended as humor. Also, a lot of humor and trash posts are based on memes. Luckily, you don't have to be an expert on memes to investigate this. Some tech-focused news websites will have articles about the history of well-known memes or other popular content on social media. There is also a curated online encyclopedia of memes called Know Your Meme, which you can use if you're uncertain whether something originated as a meme or not. For example, they have a pretty well-documented article on the history of NyQuil chicken. So question 2 is, how extensive is the reach of the misinformation? So one big factor to look for on that is whether prominent people or organizations are promoting it. That suggests that a lot of people are hearing it, even if they are not necessarily persuaded. The fact that it has such a wide audience might make it more worthy of correction. It's also important to look for varied expressions of the idea in the post. If a piece of misinformation is spreading far, it's likely being expressed in different ways by lots of different people. Finally, ask yourself, can you find lots of examples of this in the first place? Or do most of the discussions about it always seem to point back to the same few examples? If you seem to only be able to find a few examples, then the reach of the misinformation might not be as wide as it appears. Now, one tempting way to gauge reach is to look at the numbers below the social media posts, likes, shares, comments, and so on. And although these have their place, they do have some important limitations too, when you're talking about how to measure reach. So among other things, bots or automated false accounts have been known to amplify misinformation to create the appearance that there's lots of engagement and lots of agreement with a given misinformation post. Now, even though that doesn't represent real engagement, these can sometimes affect systems on social media that recommend popular content to other users. So even some of those recommended or popular post features might potentially be affected by this. Also, some patterns of social media metrics can mean different things on different platforms. Luke O'Neill has written about this in the context of Twitter. He noted that on Twitter, if a post receives many more replies than likes, this can often indicate that it's being heavily criticized. Whereas on other platforms, like a blog, that can be a sign that healthy conversations are happening in the comments. So the social media metrics on a given post are important, but they have to be considered critically if you're using them to think about a post's reach. So instead of social media metrics, how about news coverage as a measure of reach? Now, I'm not here to attack or bash journalists. That's not at all what this is about. But there are some structural reasons why reporting on social media can be tricky for some news sources. Simply put, a piece of health misinformation from social media being in the news doesn't always mean that it has a lot of reach. First, you can search for and find almost any possible opinion or behavior on social media. In fact, a very rare opinion or behavior might be deemed more newsworthy because it is so uncommon, even if it is also unrepresentative. Sometimes headlines will use social media jargon in imprecise ways. In particular, the words viral and challenge sometimes get used just to mean anything that seems like it could be imitated, even if participation is not actually common or even encouraged, like it was with the Ice Bucket Challenge. And finally, in cases deserved and not, disapproval is a common stance for some media outlets when they are reporting on teenage trends. That can include teenager-heavy social media networks such as TikTok. So a story that can be framed as teenagers do foolish things might be emphasized or highlighted partly because it agrees with that stance. So the next two questions are a little more straightforward, and you can answer them using similar steps to the questions that we've already talked about, seeing how the audience nearest the post reacted to it, and doing research with specific sources that might have insight into the misinformation. So with that in mind, question 3 is, what are the main reasons that others are sharing the misinformation? This can include similar reasons to why it was originally posted, but it can also include criticism. If most of the sharing or responses to a post are to explain why it's wrong or dangerous, then you might not need to issue your own correction. So look again at what people are saying when they repost this misinformation and how conversations around those reposts play out. Part of that needs to be looking at multiple examples of reactions to the post and seeing how it's received by its intended audience. And finally, question 4. Does the misinformation encourage imitation, participation, or other action that might be harmful? There are two sides to this. First, the likelihood that any behavior might result from the post at all, and second, the likelihood of danger from that behavior. Now, when I say behavior, I'm speaking broadly here. It could include, for example, deciding to forego an important vaccine. Behavior can include a decision not to do something as much as a decision to do something. In general, the more likely a post is to encourage harmful behavior of some kind, the more likely it is that a correction is worthwhile. Similarly to when you were examining reach, if you're looking for evidence of people acting on the misinformation, it may be a red flag if the same small number of examples are the ones being discussed everywhere. That might mean the influence of the misinformation is perhaps smaller than it appears. So just to recap, here are the 4 questions we discussed for thinking about whether a certain piece of health misinformation on social media warrants correcting. In short, I suggest thinking about its purpose, its reach, any sharing, and any action that might follow from it. Now, I stress these are questions to ask, not rules to follow or a rigid system. These questions might provide you some more information and context, but your expertise and discretion is still important in deciding what to do. For the last bit of this presentation, we'll apply these questions to some real-life examples. So let's turn back to NyQuil chicken. I suggest that the FDA made a misstep with their communication strategy in this case by ignoring most of the factors we talked about and only focusing on the danger of the behavior if it was imitated. That is, focusing on one half of the action question to the exclusion of everything else. So for purpose, NyQuil chicken is a trash post. It has actually been used for years in this way before it got viral on TikTok. In terms of reach, although it was the subject of a few viral posts, it's not clear that it had really entered popular consciousness until the FDA had posted about it. So that could go either way. It did have some reach, that is true, but it's uncertain that it was very, very extensive and thorough. In terms of sharing, a lot of the TikTok posts about it were people filming their own reactions to it and being appropriately horrified. And while the FDA was correct that cooking with cold medicine can be dangerous, it seems that it was very rare for anyone to do so. As a group, these 4 questions seem to weigh against posting a correction. But next, I want to look at an example where I think a federal agency made the right call in deciding not to post a correction to social media health misinformation. In December 2021, the CDC announced shortened guidance about isolation after testing positive for COVID-19 or being exposed to it. There were concerns about this, especially the timing of the change. At that time, COVID case rates in the United States were rising. So in response, Twitter users sarcastically attributed lots of bad advice to the CDC. These posts usually started with either the CDC says or the CDC recommends. So this was sometimes called the CDC says meme. Now, the CDC did not publicly respond to this. They just stood by their guidance. I think that was the right call. They got some criticism of the underlying guidance, but no pushback on how they responded to the misinformation being shared. So what did this actually look like? There were dozens of examples, and I have 6 of them on the screen here. Some of them got a lot of interaction. Many were related to COVID-19, but they also branched out beyond just health advice. One Twitter user wrote, "The CDC recommends that you should release your inhibitions and feel the rain on your skin." That is false. The CDC did not recommend that. That recommendation comes from the singer Natasha Bedingfield. Still good advice, though. So let's ask our 4 questions about the CDC Says meme. It's pretty clear the purpose was humor and mockery of the CDC for changing its COVID guidance. Although at least some of these posts had quite a lot of reach, the nature of the sharing was mostly people reposting examples of the joke that they liked. In terms of action, there was no intent that people would follow these fake recommendations. At most, there was some incentive to get in on the joke and post your own bad advice. Now, a few of the posts could be dangerous if they were taken literally. One example on the last slide was about taking a bath with your toaster, for instance. But overwhelmingly, the potential danger of harm to anyone from these posts was very low. In summary, most of these factors weighed against issuing a response. But as our last example, let's look at a situation where some of these questions are a little harder to answer, but where I think a correction was warranted. So last November, a Twitter account impersonating Eli Lilly and Company, which manufactures medical insulin, tweeted, "We are excited to announce insulin is free now." And you can see that post on the screen here. As context, this followed some changes at Twitter. The fake account used a new option that lets any user purchase a verified badge, which is that little check mark next to the username. And previously, to get that check mark, you had to prove to Twitter that your account was actually owned by the person or organization that it claimed to be. As I said a minute ago, I think a correction here was worthwhile. Let's talk about why. In this case, the person who posted it told us the purpose afterward. He wanted to make a point about the price of insulin and post something that would annoy a company he said is behaving unethically. Trolling like that can sometimes warrant correction even on its own. Here, I think it's important because of how it aggravates some of these other factors and makes them more pressing. In terms of reach, the post, or at least chatter about the post, did reach a lot of people, enough to contribute to a price drop in Eli Lilly's stock price. Now, to be clear, it's very unlikely that this post caused the entirety of that drop. Stock prices can fluctuate for many reasons, but the high-profile trolling likely played some role. Sharing of this post was largely for the purpose of encouraging the trolling. Now, in situations where trolling is snowballing like that, someone stepping in to clarify things can be helpful. As for action, there's no evidence anyone went to the pharmacy expecting free insulin because of this tweet. But even if someone didn't see this tweet, they might have overheard conversations or media discussion about some confusion around the price of insulin and wonder if something about that had changed. So the harmful action, as it were, is contributing to potential confusion. I think that matters given the life or death importance of medical insulin. So although it's a little harder to judge in this case, I think the action question does weigh in favor of correcting here. So that's what I have for you today. Here are the references from this presentation. And otherwise, thank you so much for your time and attention. And I believe we have some time for questions now.
Absolutely. Thank you so much. That was really interesting and entertaining. The NyQuil chicken will stick with me throughout the week, I believe. Hadn't thought about that one in a while. Since you just finished your presentation, I'll let you guys think for a second about questions, and I'll point that the question was answered for the Alaska project team in the Q&A. If you guys are interested in reviewing that, it's kind of a lengthy question and a lengthy answer. So thank you guys for taking a lot of time to be conscientious. So who has some questions for Jared Irwin? I'm going to give you guys a moment to think. There is no pressure, but you're getting some good feedback. Great presentation. People are thinking it's very interesting. I'll give you guys a couple more minutes. And you could ask questions for either group. I see a question from Dr. Jennifer Meyer.
I was just curious, Jared, we've done a recent partnership with our medical librarian at UAA and trying to see libraries as, community centers and the heart. So I was wondering if you have outreach to communities to help raise awareness around, how do we help citizens decipher or, triage what is good information, what is bad information. And it sounds like some of your tips might be helpful there. So I just wondered if there was continued work, outside Eastern Michigan University with your surrounding community.
Yeah, as a librarian, that is something I would love to explore more and expand on. I know that many other library organizations do that. Full disclosure, I used to work for NNLM, which is organizing this symposium. So I am at least familiar with some of the efforts that have been ongoing. So I know that you are exactly right. Like public librarians are very interested in this and very receptive to learning about ways for their to reach out to their communities and help them tackle some of these challenges that we face. So yeah, there's absolutely a receptive audience among librarians, whether public or academic or other types of librarians as well, who are interested in doing this.
Outstanding, thank you. I know up in Alaska, it's a very tight-knit network of librarians statewide. So sharing information out that way, I just think would be really awesome. Thank you.
Yeah.
Great idea for connection. We have a couple of questions that are in the Q&A, both at this point are for Jared. The first one is, how would you recommend institutions do or do not respond to comments that are misinformation couched in personal attacks or insults? For example, the common practice of people criticizing institutions for supporting the LGBTQ plus community by calling the institution / employees / LGBTQ people groomers. Great question, and that's intense. Thank you.
Yeah, that is a great question. I don't know that I have a great answer off the top of my head, but one thing I would try to stress is, what grooming for sexual abuse or child abuse actually is, that it is a very serious thing, and it's not something that's appropriate to be used as an attack against anyone else, whatever your political views or opinions on issues are. So that's one thing I would try to clarify from the start, what this word people are throwing around actually means. And just tying it back to some of these questions, that is something I think would warrant correction, because it's something that's affecting legislation about access to like transgender healthcare, and attacks like this are having a real impact on real people, both in terms of health and otherwise. So yeah, I believe engaging on that and trying to explain, what these terms we're throwing around actually mean and who these people who are affected by them are, could be a good way to go about educating people on that.
Well said. I'll read these out of order. You have kind of a comment. Thank you so much to both presenters. Jared, you make a great point about news outlets using terms like viral loosely. Sometimes news headlines go for the sensational language, for example, using election landslide to mean a simple majority win. So you're getting some support in that form. And then a question above that is, This is for Jared, is there a potential middle ground? Do you think the FDA should have completely ignored NyQuil chicken, or could they simply share a generic reminder about the misuses of over-the-counter medications? Is that still feeding the trolls?
Yeah, I think a middle ground could have been possible. I mean, there have been other medication challenges on TikTok and other outlets that were apparently more widely imitated and did present real dangers. Like I know one was from a few years back about misusing Benadryl, basically to overdose on that with an attempt to cause hallucinations. So that was something that was circulating a couple of years ago, I think, on TikTok. But yeah, I mean, certainly reminders about just responsible and correct use of medication can absolutely be valuable. But yeah, I think part of the reason the FDA got so much flack is because they put a lot of emphasis onto the particular example of NyQuil chicken, which seemed to be rarer than some of those other examples. But yeah, I think I don't mean to say that responding to challenges of this kind is never a worthwhile thing to do, but there certainly is room to do that in some cases.
Which brings us to probably what should be our last question on a related note, very related. What do you think about responding to conspiracy theories or other ways to do so without directly engaging? When the COVID vaccines came out, for example, there were conspiracies about specific people dying.
Conspiracy theories. Yeah, that's always tricky. I do sometimes wonder if like the most dangerous part of conspiracy theories isn't that people come to believe the specific thing that's being talked about, but that just people get a sense of unease that, oh, there might be something untoward or something controversial about this because I have heard people talking about it. Not so much that they do come to believe that specific people are being targeted for extermination through this vaccine. So personally, one way I might try to approach that is just without issuing a direct response to it, just try to share safety information about the vaccine and the fact that at this point, hundreds of millions, if not billions of people around the world have had at least one dose of it. And the vast majority of them are still walking around. So I think there are ways to at least put correct information before people in response to those kinds of claims without necessarily amplifying the conspiracy theories themselves.
Excellent.
I just put a couple links in the chat, but I think these questions are fantastic, and they also reveal why it's so important to collaborate with your health provider community, who can be the science content expert in that response, and then your communications, strategic communications professionals, because they can really help you craft a response in such a way that it's less likely to be attacked further, and you can really provide good quality information to the people that are reading the post. The other thing I thought of with conspiracy theories is it's often fun to, in your comment back, reveal the tactic that the conspiracy is using. And sometimes that can help kind of defang the intensity of that conspiracy. And I think it's the Center for Countering Digital Hate. They did a lot of work on, especially in the anti-vaccine environment, really drilling down to what were the three goals of that anti-vaccine industry, which is a globally funded industry. And that was, belittle or make the virus seem less of a threat, increase the threat of the vaccine, and decrease any kind of threat around, and increase anybody that promotes the vaccine is obviously evil. So when you kind of reveal those three goals of the anti-vaccine movement, almost all the anti-COVID vax misinformation falls in one of those three categories. And I think that helps kind of reveal and neutralize the impact of misinformation. Anyway, thank you for a great talk.
Oh, thank you all for your excellent talk as well.
Absolutely. Everyone made like such a good connection. I think you guys could be co-collaborators in your field. And I feel like everyone who attended learned lots of tools and information that they can utilize. So thank you sincerely to each of our presenters today. Just a few items before we end our session. If you are interested in MLA CE credit for this session and others, you will receive an email after the symposium ends with a questionnaire and instructions to claim CE credit. Thank you for joining us for the final day of the Health Misinformation Symposium. At 4:10, join us for the closing remarks from Martha Meacham, Project Director at NLM. Thank you very much. If you have any questions, always feel free to reach out, and we appreciate everyone being here. Thank you very much.